Researchers at the Terry Research Lab at the University of Nebraska-Lincoln have created a new method for treating acute respiratory distress syndrome. Acute respiratory distress syndrome, or ARDS, is a serious respiratory condition with no direct cure that contributes to the deaths of over 80,000 patients in the United States every year. Conventional methods of treatment for ARDS are expensive, high risk, and require extensive training, and have recently been shown to carry a mortality rate of nearly 50%. A new therapy, peritoneal microbubble oxygenation, or PMO, is under development by the Terry Research Lab in collaboration with the University of Nebraska Medical Center and the Borden Research Lab at the University of Colorado Boulder. Funding for this research is provided by the NIH and the U.S. Air Force. PMO is performed by introducing oxygen microbubbles, pure oxygen gas spheres encapsulated by a phospholipid membrane, into the peritoneum. The gas diffuses from the bubbles directly into the abdomen, allowing for rapid delivery of oxygen into the bloodstream independent of the lungs. In a recent study, the feasibility of PMO was explored by treating rats with ARDS. ARDS was induced by using aerosolized lipopolysaccharides to inflame the lungs. The rats were then treated with PMO by receiving a bolus of oxygen microbubbles via intraperitoneal catheter. The bubbles were extracted and replaced every 12 hours over a total period of 48 hours. At the end of the study, rats experiencing ARDS and treated with PMO had an 80% survival rate, while saline-treated and untreated rats had 57% and 43% survival rates. Rats treated with PMO also had significantly higher levels of peripheral oxygen saturation and lower incidence of edema, hemorrhage, and inflammation of the lungs when compared to control groups. These results indicate PMO as not only a promising means of supplying life-sustaining oxygen under hypoxic conditions, but also a potential method of improving lung health in both en route and hospital settings. Further studies are underway to optimize peritoneal microbubble oxygenation as a treatment for ARDS and for further biomedical applications.